Hi, I'm Amanda Crowell Itliong, and I'm really glad to be here with you today. In 2008, I lived in lovely San Francisco, but on the big day, I woke up in Denver, ready to present at an important conference in my field. And that morning, as I was reaching for my presentation materials to head downstairs, I felt the absolute most terrible pain I have ever had. Soon, I was lying on the floor of the hotel lobby, getting ready to leave in an ambulance. And after many IV meds in the emergency department, they gave me a transvaginal ultrasound to discover that I had an ovarian torsion. The surgery plan was simple, to go in right away with some tiny little cuts and untwist my insides, but it didn't go as planned. While I was deep under anesthesia, with my body cut open hip to hip at that point, the emergency surgeon quickly called in pathology and called my husband at the time, who also called my parents. And while I was out cold, all these people decided what to do with me. I woke up from surgery in a hospital room in a faraway city alone, and a nurse came in to check my vitals, and she told me she was so sorry to hear that I had cancer. Yeah, that's how I found out I had cancer, when absolutely nobody had even mentioned the possibility. I was told I had borderline ovarian cancer that was staged at 2B, and all of this started the 12-year journey that I've been on since. Next was more debulking surgery, this time by a gynecologic oncologist. And that same gynecologic oncologist then explained that I'd never have to worry about this again. She promised that she removed all the cancer and I was free to go on with my life. Unfortunately, that didn't work out either. I spent the next 2 years trying to get pregnant with just a piece of one ovary and one tube. And the whole time we were watching new masses grow. I did get pregnant, but miscarried, unfortunately. And meanwhile, the masses had grown a lot. It was super scary. I decided to take charge of my fertility and my cancer by finding a new gynecologic oncologist who performed a total hysterectomy for me. The surgery confirmed my first recurrence, and my cancer was restaged up to 3C. After a few years and some new back pain and digestive issues, I had another surgery that confirmed another recurrence. Pathologists now said that I had low-grade ovarian cancer. I endured the classic 6 rounds of carbotaxyl chemo, and CT scans confirmed another recurrence. I was on an aromatase inhibitor for 8 months, and that also didn't work. In March of 2015, when I was told I had cancer for the 4th time, my doctors also told me that they didn't have any other treatments left for me. I had to face my own death and the fact that it really could be soon, and while my body could still do it, I left my beloved career in higher education to have new adventures and spend some time with people I love. It was known as my #NotDeadYet tour. After a few months of travels, I heard about a new international clinical trial opening up for patients with low-grade tumors. And after all the qualification tests and paperwork, I was lucky to be accepted into the clinical trial. It started with 4 rounds of a standard of care chemo. They did Doxil, and that didn't work at all, so they transferred me over to the experimental arm of the trial, and I started taking daily trametinib pills for 6 months. At that point, I had to reduce the dose and take a month off because my side effects were so severe. I actually looked like an extra from The Walking Dead because I had these open, bleeding sores all over my face. And then I had 3 more years back on the clinical trial drug, which kept my tumors stable. On a side note, we also discovered brain tumors in my midline cerebellum. They're fascinating because they could be metastasis, which for low-grade ovarian cancer would be incredibly rare, or they could be totally unrelated primary tumors, which would also be incredibly rare, especially at my age. I'm kind of a unicorn. So since then, I've started a new treatment plan with daily Cytoxan pills and Avastin infusions every 2 weeks. And when I could feel another large tumor, like I could feel it through my skin, we did another major abdominal surgery to remove it. These days, I still have cancer at the top of my vaginal cuff, and I'm in treatment. I'm also kind of like an alien because I have no belly button. So today I'm 41, I'm disabled, and I still have ovarian cancer, but as you can see, I'm still smiling and really happy to be alive. Positive impact has really always been my purpose. And I've had to push pretty hard over the years to be included as a patient in places where important work in healthcare is being done. My goal now is to leave the doors open a lot more widely for patients from all backgrounds. I'm proud to serve on patient advisory boards, and as an activist, I fight for quality healthcare for everyone in this country. I started a grant-funded program with my gynecologic oncologist and my nurse practitioner to help patients who are newly diagnosed with ovarian cancer with a 6-session interactive course. Based on my education and talents, I created and facilitate the personal development aspects of the course, and my health colleagues focus on the medical information. Lately, I'm particularly focused on racial disparities in gynecologic cancer. Coming from a background in education and sociology, I'm actually pretty shocked that there isn't a lot more solutions-based medical research on these important topics. I connected with an amazing radiation oncologist, and we've started a team of patients and doctors to center the marginalized voices of Black patients with gynecologic cancer. We'll be using their stories and direct experience to create educational tools and resources, not just for physicians or nurses, but for everyone in the healthcare environment who interacts with patients. We believe that every single patient contact has the potential to support or to oppress. I'm serving the team as a sort of project manager where I'm able to use my skills and experience managing teams and working on a community-based research. It's been inspiring, it's been challenging, and it's been so humbling to do this work alongside physicians and researchers that I admire so much. I hope that all of you in the health professions recognize patients as your partners, respect us as partners. Don't ever forget that we can often help you create meaningful change in the system by using our personal experiences and talents. The only chance we have to make the future of healthcare better for all of us is by working together. Thanks for your time. Have a great day.